chambers at 3:30 today. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals in the media may also be audibly and or visually recording this meeting. Madam Clerk, are there any changes to the agenda?
Yes, Mr. Mayor, we do have an added item, 9.1, Active and Sustainable School Transportation Charter. And also at the appropriate time, staff are requesting amendment to item 7.1, and copies have been distributed.
All right. And may I have a motion to approve the agenda as amended? Councillor Pearson, Councillor Johnson, all in favor? Carried. Thank you. Any declarations of interest? Hearing none. Councillor. Well, then arrive early and get it determined then.
We'll be in public works all day, Mr. Chair.
Are there any, we've had no declarations. A motion, please, to approve the minutes of January 13, 2014 as presented. Pearson, Johnson, all in favor? Carried. Thank you. Items 4.1 and 4.2 are requesting to address the board today. If the board is in agreement, may I have a motion, please, to waive the rules to allow the delegations to speak today following item 6.2. Councillor Clark, Councillor Pasuta, all in favor? Carried. Thank you. A motion, please, to receive items 5.1 to 5.3, the consent items. Are there any questions about the consent items? Moved. Clark, Pearson, all in favor? Carried. Thank you. 6.1, public hearings and delegations. I have our first delegation, Mr. Sean Corner, to the podium, please, wishing to address the board respecting the development of a new approach to dealing with pests in rental units. I would like to remind the delegation of the 5-minute time limit, so sir, please come forward. Oh, there you are. Okay, you're hiding.
Good afternoon, Mayor and councillors, and I appreciate the opportunity to speak to you guys today. I did have a council meeting on September 16th last year where I suggested to council that we need to have a certification just like restaurants for apartment units in Hamilton. My community where I'm from is very marginalized because often we're poor or on some sort of assistance, and generally I think people that are renting apartments have less of an ability to wage war against landlords and to go through this long, arduous system to get any kind of resolution on these problems. What I'm seeing is, personally, since September 16th's meeting, my landlord sold the building to another landlord, and this new landlord, rather than tackle the cockroach and bedbug problem, was more interested in the lighting retrofit so they could get more rent. And I understand the business and everything, but it's people that are being affected. I moved into a building where I was promised it was clean and pest-free, and it wasn't. And I've lived with this problem for 1 year and 3 months, where I still have cockroaches in my apartment. I've been to the Board of Health. I've been to the both to Steve Susnick, the Board of Health, and I've also been in touch with Proper Standards guy, Stephen Woods. There's other problems in the building, but the one that concerns me is the ongoing cockroach problem now. I don't have bed bugs. They treated that, and thank God they haven't come back. And now I'm being blamed for the cockroach problem. And I'm flabbergasted. I came to council, and I told them the problem I had, that it's been left up to regular citizens when they apply for an apartment building to ask if there's a pest problem. And I want that eliminated. I want it so that it's between the government and the landlord. And there shouldn't, because when I go to a building looking for an apartment and I say, do you have cockroaches or bed bugs? They don't want me. They think I'm either a troublemaker or I'm bringing cockroaches and bed bugs, or that I had a problem in the past with cockroaches and bed bugs. And they don't have to approve my application. There's no human rights provision that forces them to accept me as and I'm being marginalized, and it's very difficult to find an apartment nowadays if you don't have a good credit rating. And who are the people that don't have good credit ratings? People on welfare, people on assistance, people marginalized with being poor. And those are the people who are renting apartments. It's not rich people, they buy houses, and they live in houses. There is some condos and nice apartments for well-to-do people, but I'm talking about people like me, people that don't make $1,000 a month and have to go through a tribunal process, and while they're going through it, they're being threatened with eviction. In my building that Skyline owns now, 165 Queen Street South, they've cut off the water 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 times since November for all day to work on their building because their building is so decrepit. I've had 17 notices of entry where they want me to be available all day long from 9 to 5 so they can either have a fire alarm test or a spraying or a cockroach baiting. And normally, I want the problem dealt with, so I was letting them in. But it's excessive that I take care of my 85-year-old mother who has Alzheimer's, and she's a handful. And I brought her to the last council meeting. Maybe some councillors remember her. And the mayor shook her hand, and that was a high point for me because, I like being part of this process. I like seeing a problem and finding a solution and not letting that problem just continue and continue and continue year after year, year after year. And that's what's happening with cockroaches and bed bugs, not just in Hamilton, but everywhere. But I'm saying you guys are, if we did have a certification like restaurants, where it's an open policy, where it's right in front of the person before they apply for an apartment, that it's clear to that person that they have a cockroach problem or pest or bed bugs, or they're working on it with a yellow, or damn it, they shouldn't be able to rent out an apartment that has cockroaches or bed bug problem right then and there. And they do. I've been to a number of apartment buildings in Hamilton where there was active cockroaches in front of me while I'm looking at the apartment. And it's almost like I'm forced to take the apartment. If I don't, who else is going to take me? I mean, if I go to 4 places and they all have cockroaches and the other ones are unaffordable to me, and I can only look for apartments for so long. I have to take care of my mother. I have other things to do. Right now I'm going through a tribunal process with this landlord now, where I'm fighting for my rights, and I look at it as kind of like a reprisal. I mentioned that in council the last time. I was worried about reporting Homestead, which is a very well-known name here for apartment buildings. They have the tallest building in Hamilton, and they should be ashamed. Honestly, they should be ashamed of themselves for renting out apartments with cockroaches and bed bugs. Because I'm sure, and no offense to any of the councillors, and I respect you all in your jobs, but I'm sure you're not staring at cockroaches every day. You're not worrying about them going through your stuff. You're not worried about them crawling on your mother at night. I do. I see it every day, and I'm tired of it. And it's been a year and a half, almost. I feel if this program was adopted, that it's going to eliminate guys like me coming to you and complaining, because it's going to be a closed loop now. Now a landlord cannot rent an apartment unless it's been approved by the city as being clean and cockroach and pest free. Furthermore, if they do have a problem, if they are willing to do the caulking and the spraying that is necessary and being supervised by the city, they get the yellow, which means they can still rent the apartment, but at least the tenant is aware of that. And then the red would be that the landlord is not living up to their obligations. There is still an active cockroach or bedbug problem. They shouldn't be allowed to rent or charge rent to people that have those apartments. And right now it's up to that marginalized person to come up with $45 out of a welfare check to get justice. And I'm going to tell you, I need that $45 to pay groceries. And I'm not the only one being marginalized here. I'm one speaking for the many. And we don't have a voice. In my apartment building, there's no association, and people are being pushed around right now in my building by this landlord. And their attempts to make me look like I'm a demanding, aggressive person. You're damn right I'm demanding, and you're damn right I'm aggressive. Because this has gone on too long, and it needs to be dealt with. And I'm not rude. They're contending that I was rude, and they're contending that I'm swearing, and they're trying to besmirch my character to get me evicted.
Sean, we have a 5-minute limit, and I think you've covered over a couple of times now the points that you've made. Is there anything else that you want to? I do have a speakers list that talk to you. So
I'm good. I just wanted to let the council aware of what's been happening since September 11th.
No, that's
16th.
Fine. Thank you. And Councillor Jackson, I believe you.
Mr. Mayor, thanks. And Sean, I think a number of us, including myself, are catching up to what you and Ruth brought forward about a year and a half ago. And have you seen report 7.1 today from our public health department, Mr. Mayor, through you to Sean?
Unfortunately, I haven't.
Okay.
My internet, I couldn't afford it this month, so I have no ability for the computer right now.
So Sean, I'm sure our legislative assistants will get you a copy of the report, and I'm sure you're going to stick around. The B part of it references you and the potential, the feasibility of a possible registry for rentals, but it goes beyond that as well. So hopefully that will capture the essence of what you brought forward, and there'll be other examples, Mr. Mayor, I'll be bringing forward after staff's presentation. So Sean, thank you for your patience, and I think we're hopefully going to get to maybe not exactly where you want to get to, but at least the matters being the radar and the awareness of it has been elevated. Okay, thanks, Mr. Mayor.
Any further questions of Sean? So I'll ask for a motion to receive the delegation. Pursuit Pearson, all in favor? Carried. That's carried. And please stay as long as you can. Take an agenda with you, and you'll notice the item that has been referred to, okay?
Thank you for the opportunity, Mr. Mayor. Appreciate it. Happy St. Patrick's Day, everybody.
Happy St. Patrick's Day. Now, so we've received, and now we have, next I want to call upon Elizabeth McGuire, wishing to speak to the Good to Go food box. Elizabeth, where are you? No, I have it on 6-2. Not present? Okay, so we'll just set that aside for now and deal with it later. Susan Muma also speaking with regard. There you are. Hope, Hamilton Organization Poverty Elimination. Welcome.
Hi, Susan's gone up transformation. My name's Ann Newbiggie, and I'm speaking on behalf of Susan. She unfortunately couldn't make it today, so she has given me. Is that better? That's better. Okay. This is what she has written. Whoops, I better put my glasses on. I am a member of Hope Hamilton, which is Hamilton Organizing Poverty Elimination, and as such have become familiar with the Good to Go food box. I've also been delivering the food box to 5 recipients since October or November. Recipients have expressed their delight at receiving the fresh produce and commented on the quantity and quality of the food. I'm very happy to see that the city is funding this initiative to offer fresh produce to single people on Ontario Works. As you know, these people receive very little money in social assistance, and it is very hard for them to keep body and soul together. The provision of fresh produce not only gives these singles nutritious food for the body, it also lets them know that others recognize and care for them. I really hope that the Board of Health continues to support the Good to Go food box and that the city continues to fund the program. I'd just like to add my personal experience. I've been handing out the good food boxes at the Freeway Cafe, and the gratitude of the recipients is overwhelming, and it brings tears to your eyes to realize how important this one bag of food is to them. So I'll add my thanks to Susan's for council to continuing to support the program. Thank you very much.
Thank you. And just hold on, please, because Councillor McCaddy is on our speakers list. Go ahead, please, Councillor.
Thanks, Mr. Mayor, and thanks, Ann, for being here today to speak to the Good to Go food box. And I know Councillor Maroulis has been working on this as well.
Yes.
And the direction that council has taken, the program was meant to be finished about this time or even a little bit earlier.
Last February, yeah.
Yeah, as a one-year pilot project. But what council has decided to do is to extend the program until August. And staff are doing an evaluation of the program to see how it functioned, how could we improve it, if we were to carry on, what sort of changes would we make. And I know I've been involved in some of the discussions. There have been a couple of hiccups in terms of how to deliver the program. And I know folks have some ideas on how to improve that, that I think you probably have some ideas as well. So that's where we are. It goes till August. I think between now and August, we probably should, be speaking with staff to see how that's going to go, and if it's a positive review by staff, and we have some interesting ideas, we need to find a way to continue the program. So I think that's sort of in the next 3, 4, 5 months where we need to be doing, Mr. Mayor. That's my sense of it.
Thank you very much. And thank you for presenting today, and we have no further speakers, so I'll take a motion to receive the presentation. Councillor Collins, Councillor Jackson, all in favor? That's carried. Thank you very much. Now we go to presentations, and it's my pleasure to invite Susan Harding Cruz to come forward for the bed bug strategy presentation.
Good afternoon, Mr. Mayor. I'd actually like Kirsten Maxwell to also join me from Housing Services Division. Before we start the formal presentation, we actually have a couple of letters to read out from two people in our community who have been dealing with bedbug issues, just to give you a sense of the challenges that they have faced. So the first one that the first one I'm going to read out is actually from someone that I think most councillors know. It's from Nicola Patty from Ward 1, the administrative assistant. She's also a bedbug action group member and has had this issue. I'd like to read this out. Dear members of the Board of Health, over the years, many distraught people battling bedbugs have called the Ward 1 office. Although genuinely sympathetic, I didn't fully appreciate their trauma until it happened to my mother. I can honestly say it is one of the most physically and emotionally stressful life experiences. My mother had recently moved to a lovely brand new building. In the summer of 2010, she showed me strange bites on her arm and leg. A walk-in clinic doctor didn't recognize them. Google identified them as bedbug bites. We were in shock. Her newly furnished apartment was clean and neat. Even though she understood that it's no one's fault and could happen to anyone, my mother felt terribly ashamed and deeply distressed. The one place that was supposed to be her refuge and place of rest was the only place she was attacked every night. It was a place of torment. We immediately told the superintendent, who asked us not to say anything to anyone because he didn't want to spread panic. The next day, their PCO inspector did a cursory look around the bed and determined there were no bugs, despite evidence of the bites. It was extremely fortunate that before he left, I looked through the folds of the bedroom curtain and captured one on Scotch tape. A treatment was scheduled in 2 weeks. That night, I did some research and I realized the full extent of what was ahead of us. It was clear that preparing the apartment was not what most of us equate with a pesticide treatment. This needed to be much more thorough. There was no way my mother would be able to tackle this alone. So we began the process of dismantling her life. Every single item in that apartment was wiped down with hot water and packed away into sealed plastic bags or bins. Clocks, lamps, shoes, mementos, electronics, paintings. All her books were sealed up for an anticipated 2 years. We began the exhausting process of laundering everything, putting washed items into new, tightly sealed bags, now marked clean, not to be opened. Every switch plate was removed, furniture pulled from walls, drawers removed, items turned upside down and inside out, to make every crack and crevice accessible to a pesticide treatment. That would leave a terrible mess and reportedly was not entirely effective. We then vacuumed daily, while waiting another 2 weeks for eggs to hatch and the second treatment. The process took over 4 weeks. It was overwhelming, expensive, exhausting, and completely necessary. Not because they were everywhere, but because even one egg-carrying female left behind would mean a rapid reinfestation. During this time, I realized that secrecy was an ally of the bedbug. I asked the landlord to set up a public health education session for all the tenants. It was explained that an infestation was no one's fault and fast action was in everyone's best interest. It was after this session that 3 other tenants disclosed, including the neighbor beside her, who had been living with an infestation for many, many months. Her treatment was successful because we acted fast, everyone came forward, and the infrastructure was new. Since then, other tenants have had infestations, including my mother again 2 years later. It was disheartening news. Even though the tenants and the landlord now know what to do, dealing with bedbugs will always be stressful and a challenge. They are not going away. Through work, I've talked to many people that don't have practical or even correct information. Many don't have the capacity, stamina, or real-life support they desperately need to sustain a bedbug battle. This is one of the main roots of the problem. We have a vulnerable population who have nowhere to go for actual help inside their homes. Reinfestations are common, and bedbugs continue to move from home to home, decimating multi-residential buildings and people's lives. We need a sound bedbug strategy that includes all parties: education for individual homeowners, tenants, landlords, and pesticide companies, real assistance for the vulnerable, and the recognition and financial support from all levels of government. Bedbugs are hard to control, but not impossible. Thank you. And that's from Nicola Patty.
All right.
So the other letter, Kirsten will read that letter off.
Thank you. This letter is from Maxine Wilson, who's a tenant at First Place, who's been plagued with bed bugs for the last 8 months. Dear members of the Board of Health, thank you for the opportunity to express the absolute horror that comes when you discover you are a victim of a bed bug infestation. My nightmare began last June 2013. A few months before my infestation, I attended an information session offered to the tenants of this building. I thought it was informative, but I have since realized there was much more to be learned. Having gone through 8 sprayings and all of the frustration that goes with infestation, bedbugs infiltrate every aspect of your life. I'm forever changed by this experience. I've learned that spraying is not the sole remedy. You must be constantly vigilant, especially if you live in an apartment complex with people moving in and out on a regular basis. Your mental state of mind is so effective. This whole situation has almost made me crazy. Isolation from family and friends becomes very lonely and depressing. I've only been bug-free for a couple of weeks, and I'm still not completely comfortable. My sleep in the last 8 months was broken up several times in the night, and I have nightmares about these bugs. I'm continually brushing myself off. It's become a habit. I found I could not sit in one place for very long for fear of a bug crawling on me. I miss my family gatherings because of the stigma, fear, and embarrassment of having bed bugs. I was home alone for Christmas this year, heartbreaking to say the least. I would not wish this on my worst enemy, and I pray this is the end. My infestation is very labor-intensive. Vacuuming becomes a daily necessity. I think I've become a little OCD. I'm still patrolling the apartment every few hours, checking the double-sided carpet tape I have surrounding the perimeter of each and every room. Shoes and slippers are never left on the floor, and all of my clothing is in Ziploc bags. This whole experience has been very costly. Thank goodness for Visa. I've purchased at least 15 rolls of carpet tape, sprays, powders, storage bags, and plastic boxes used for holding shoes and storing clothes that normally would be hanging in a closet. I also purchased 2 hand steamers, which I use continually. I'm not sure, but there may be the possibility of creating mold from so much steaming. In the beginning, I removed the baseboards in every room and caulked between the floor and the wallboard. Then I replaced the baseboards, feeling confident the problem was solved. I was so wrong. The bugs are coming out of the light switches, so I removed all the switch plates, put diatomaceous powder into the openings, taped over the openings, and replaced the switch plates. I begged for help from management here, but the urgency of the situation was somehow overlooked. The procedure from treatment, from my perspective, is much too slow, adding greatly to the frustration. After reporting, you must wait for an inspection, sometimes for a week or more. Then you wait for a week or more for a spraying date. Simply put, too much time passes. There's a lack of basic communication. Management needs to provide the tenant with practical steps and useful information on how to proceed at the very first contact, and if possible, offering physical help to those who need it most. Management eventually decided that the baseboards had to be removed and disposed of. The removal caused horrible, ugly gaps where they were once glued. I bought white paint to cover the area where the baseboards were, enabling me to spot bugs crawling on the white surface. I caulked and painted my kitchen and bathroom white so I could monitor them. The labor never ended. Management has finally agreed to remove all of the carpeting and replace it with flooring. That's actually where Maxine is this afternoon. I'm very thankful. It has been a long time coming, and the future does look a little brighter. P.S. By the way, the TVO documentary Bite Me said it's safe to put items in the bathtub to keep them from picking up bugs. Wrong. Bed bugs are capable of coming into the tub via the drain or overflow drain. They come through any opening. For the record, it takes a good 2 hours for a bed bug to drown. I documented every bug I caught and where I caught it. I found there was no real point of origin. I caught them in every room, on the ceilings, walls, floors, closets, everywhere. And during these past 8 months, I've caught over 200. I've found writing this somewhat cathartic, and I thank you for the opportunity. If in any way my information from this experience can be of any assistance to you in the future, please do not hesitate to call me. Yours truly, Maxine Wilson.
Thank you.
Excuse me. So after those two very expressive explanations of issues they've dealt with, we'll get into the presentation. So this presentation is going to cover these areas. We're going to have a brief introduction of items. We're going to cover bed bug information, some basics about bed bugs, the impacts of infestations and the trend, what's been done in Hamilton, and what needs to be done. So as you've heard, bed bug infestations are continuing. You may recall dealing with bed bugs over the last couple of years. We have been to Council or Board of Health in the past. These are complex and costly and hard to control. There's lots of steps involved in preparing for treatment. It's not simply somebody walking in and putting down something to get rid of these. It does take quite a lot of effort. We did have some one-time funding, which I'll explain later in the presentation, was from Ministry of Health and Long-Term Care. However, that was only one time and it did end. So this has kind of left us with a gap in services. A couple of years ago, we did have the ability to help our community with some vulnerable population, to help them with some prep costs and with taking them through those steps and offering them some resources, but that funding ended. So now we have this gap where we really don't have sustainable funding. So we are looking to see what we can do in the future to have this program well supported. So right now we're looking at some interim funding in order to help us create a community bed bug strategy, which would also, that would be one part to develop the community bed bug strategy. We're also looking in this presentation recommendations for to help vulnerable residents. We need to have some support for them to help in the prep. As you've heard in the two letters, there's a lot of effort required, physical, and a lot of stamina to actually get ready for treatment, lots of preparation involved. Also resources, things like mattress covers, etc. So I'll go through that in a moment. As well, we are asking for a navigator role as part of this report and recommendation. And this navigator would actually not only, we wouldn't just be helping with preparing and offering resources, we would actually have a person, a point person, really helping people through the whole step and process of getting their place ready for treatment and following through on that. So first you need to understand, we all need to understand about bed bugs generally. These bugs really aren't going away. Similar to other pests that we enforce, we have mice, rats, cockroaches, fleas. These are all, unfortunately, pests and bugs that we have had to deal with for many years. We know these are not going away. We need to understand them. We also need to understand about bed bugs. So here's a graphic of all of the life cycle of bed bugs. If you didn't already know, they go through many stages. They start off as a little egg, and then they go through what's called the nymphal stage. So there's 5 of these stages, so they get bigger and bigger and bigger and molt each time, leaving the skins behind. So you could see little eggs, you could see little sizes of different nymphal stages until you get to the big round adult stage of the bed bug. So some facts. Part of the challenges of bed bugs is they can live a long time without actually feeding on blood. They need to eat blood in order to survive, so that's all they eat, but they can survive months without it. So they can be in an empty apartment and someone can move in, and if there's eggs present or adults present that haven't eaten, they're going to be looking for a blood meal. They can also live for a year. The females lay 5 to 7 eggs a week, so they're very busy creating eggs. And the ideal temperature for creating these eggs is 27 degrees or about 80 degrees Fahrenheit. So in the summer months, they are more active. As you've heard from the letters as well, these bugs can hide very well after they feed on a person. They will retreat to cracks in the baseboards. They'll be in fabric seams along the mattresses. They can be inside the mattress, along the edge of the mattress, deep into furniture. Anywhere people are residing and active, they can find a home. They're also very unfortunately resistant to, these things are hardy, so they live a long time and they also resist temperature extremes and treatment. They have a very hard outer shell and exoskeleton, and it's really, really hard to control them. One of the public health issues is they aren't known to transmit disease. They may carry some pathogens, but they're not known to transmit any disease. So they're unlike other vectors like mosquitoes that can transmit a disease. So they don't transmit disease. However, they can cause a variety of reaction for people who are bitten. Some people won't even know they are bitten by a bed bug. They may not react. Similar to mosquito bites, some people may react quite a lot and be quite itchy. If you're a child, you may scratch a lot. It's harder for young children to stop scratching, so they may go on to secondary infections and even some scarring. We've learned through Toronto's experiences that bed bugs, if you have bed bugs, you're dealing with that and you have that fear maybe of that bed bug, but then you also start to fear other insects that you may come across. If you have an ant infestation or spiders, you may just get an enhanced fear of those other bugs. And of course, if bed bugs are in your bed and they are feeding on you, so a lot of people can't sleep, they have sleep deprivation, a lot of anxiety about bed bugs being in their bed. And unfortunately, people also feel a stigma attached, even though they can be anywhere. Bed bug infestations, if people have them, they are ashamed to have them. They don't want to go out. They don't want to have it spread. Friends and families may also wish to stay away. So in order to get ready for treatment, some of the things were described in the letters. I'll just review them again. Really, you have to wash all of your clothing and have it dry on high heat in your dryer. You have to even take down curtains, try and launder those as well. Vacuum your mattress, vacuum up the bugs and the eggs so that you can actually physically remove them. And then you got to remove that bag so they don't escape and start to get reinfested into your apartment or your home. You've got to move furniture away from the walls to get ready for the treatment of the pesticide. And if you have a lot of items in your home, you have to remove them and not just clutter, but empty your drawers beside your bed. You've got to empty everything out, package it all up, seal it all away. And then you've got to stay in that mode for at least the second treatment so that it gives a chance for the eggs that may be still around, they'll hatch and the treatment comes and it can kill those eggs. So you don't want to open up everything again and have everything get reinfested. So for Hamilton, since about 2006, we've always had bed bugs. They're never going to go away, but they used to be in very small numbers for complaints until about 2006, and then it started to really take off. So we've had a 600% increase of bed bug complaints. And because bed bugs can move easily, they don't fly, but they can walk pretty quickly. In multi-residential units, there's highways around all the pipes, and from place to place, it's easier for them to infest multiple units. So why do we have a rise in bed bugs? It's nobody's fault. We want to keep emphasizing that it's not anyone's fault. The enemy is the bed bug, and we are all in this together to be fighting this bug. It can happen to anybody. Some of the experiences are that we do have a lot of human mobility now and a lot of travel, so we can be transporting them around. Unfortunately, they can hitch rides on our bed. If we have backpacks or other items, they can hitch a ride. Again, these bed bugs are hardy, so they are becoming resistant to insecticide, and so it's harder and harder to kill them off. We also say there's some acceptance or lack of awareness. If you don't know you've got bed bugs, if you haven't been exposed to them, they say people under the age of 50 really haven't seen bed bugs in their lifetime, so it might be something new for them to be seeing them locally. Also, if you've come from somewhere where you're just happy to have housing here, you have, somewhere safe to live, if you've come from another country, then bed bugs might not really be your main concern. You're just happy to have a home. As I said, there's pesticide limitations. So it'd be good to say, why couldn't we just have a greater insecticide? Why couldn't we have a better product? There's maybe not the market here in Canada yet for companies to make it worth their while to come up with a new treatment, so that's part of the barrier. And again, the bed bug is starting to become resistant. So what's been done? Well, in October 2010, Hamilton formed the Bedbug Action Group, and there are some members in the audience who have joined us today. Public Health Services, Community and Emergency Services, other city departments are part of the Bedbug Action Group. There's also multiple community sectors like Housing Help Center. So we all came together in 2010 to try and look at this problem and see what could be done. So some of the members, again, are listed. It's Nicola is one of the members, as I said earlier, Hamilton Public Library, and the Health and Safety and Wellness staff from the City Manager's Office. We also have landlords and tenants represented on this BBAG group. Canadian Mental Health, because we recognize there are some mental health issues that can be associated with bed bugs. So we have a lot of members together. However, we are facing some challenges to really come together, and I think Kirsten will speak to that a bit more about why we want this strategy. So we did have some one-time funding from the province. The province had a $5 million envelope of money for the whole province. Hamilton submitted for some funding. We were successful in getting about $234,000. We received it in June, and it lasted till the end of March of 2012. In that time, we were able to help for the prep costs for 45 rental units, so to help offset some of those costs. We also had a temporary community resource who was able to go out to the community and give presentations to tenant groups, landlord associations, to really get the word out about bed bugs. And at the time, the public education campaign was really focusing on what is a bed bug, because again, people weren't that familiar with what it looked like. We also were able to give out some mattress covers and other resources. So if you recall, this is a bed bug ad, would be on different shelters, bus shelters across the city, and in other resources. And then this is the typical kind of mattress cover that keeps the bed bugs in. So if you put the mattress cover on an infested mattress and you keep that cover on for a year and a half, the bed bugs inside will finally die. So they can live a long time, so you got to keep that cover on a long time. As for complaints, this is complaints of bed bugs that are enforced by public health inspectors and public health services. That's staff on my team. We get an average of 605 complaints a year about bed bugs. And just to point out that these are generally rental units. These are not private homeowners. If they are calling us, they're just asking for general information inquiries. Of course, these are also only the ones that are reported to us, people who call us. This does not include unreported infestations that are going on across the city. And also, since mid-2013, we had a new triage program where any calls that came to us that were actually part of City Housing Hamilton, those calls now go directly to them. So this 605 is really from the community and not including City Housing Hamilton calls. So again, when an inspector goes to investigate a complaint, just to give a sense of where we look for bed bugs in curtains, behind pictures, behind lamps, in the dresser drawers, in the mattresses, etc., and behind light switches. So they go everywhere, these bugs. City Housing Hamilton is one social housing service provider in the city. They are the largest one, so we've used them as an example here. They have their own internal program to deal with bed bugs, and so they issued almost 5,000 work orders in their housing stock. They've got 7,000 rental units and 13,000 residents. They've dealt with almost 5,000 work orders and dealt with over 13,000 phone calls in and out for dealing with bed bugs. Current staffing in public health services, we actually don't have any direct funding dedicated for bed bugs. Our bed bug work is part of our bylaw enforcement. Public health inspectors enforce Section 26 of the Property Standards Bylaw, and that's again covering rats, roaches, mice, fleas, and other pests. So bed bugs is one portion, but we don't actually have any dedicated funding for that. Our equivalent for staffing resources is it takes about one and a half staff to deal with all of our calls. Similarly, in City Housing Hamilton, they have no dedicated funding, so they do receive funding from the city, but that's for their maintenance budget, so they're actually kind of borrowing from their maintenance budget to deal with the bed bug problems. And really, this is going to have a long-term effect because it's taking away from money that could be spent on maintenance of this housing stock. So they have 2 bed bug inspectors and an information clerk. So what needs to be done? Well, we do have this service gap. When the funding stopped in March 2012, we did try and carry it on through gapping dollars for the rest of that year. But we really have a gap. If someone is not on Ontario Disability, on ODSP or Ontario Works funding, where some of those people can get some support if they need help with prep costs. If someone is not in that group, if they're low income or a senior, there's really a gap. We don't have a nice fund anywhere right now where we can say, oh, we will help with your prep costs, and we will also help you through the process, and we'll give you some mattress covers. We also don't have a navigator to really take the time to be with the person and help them through all of the issues that come along with the bed bug infestation. And they may not only be dealing with bed bugs, they may also be dealing with other social determinants of health issues. So this navigator, we really want support for them to help them through the prep process, and then to link them to services to really support them. And our recommendation, just want to emphasize, there is no impact to the operational levy for the request for a navigator. So I think we'll turn it over now to Kirsten to complete the presentation. Thank you.
Thank you, Susan. Because efforts to date have not contained the spread of bed bug infestations in Hamilton, a comprehensive and integrated plan is needed. We need to understand best practices, we need to coordinate and integrate across sectors, public, nonprofit, and private, and we need to make sure that our resources are being used optimally. Also, a bed bug strategy implements a critical investment strategy of the Housing and Homelessness Action Plan, Strategy 4.5, which is to develop and implement a proactive and coordinated strategy to address bed bugs. And a bed bug strategy would address Mr. Kummer's comments today and from September 16th, item number 6.3 on the agenda. For landlords and property managers, the cost of bed... Nope. Oh, for goodness sakes. Okay. For For landlords and property managers, the costs of bed bug remediation are outweighing profits and driving up costs, driving up rents, which ultimately increases the risk of homelessness. One of the primary concerns of landlords and property managers is the inability of some vulnerable tenants to properly prepare for treatment and the lack of services to help them do so. Susan talked about the necessity for so much preparation in order for treatment to be successful. And it's necessary because the available pesticides just aren't that effective. The bugs have to be sprayed directly, and the pesticides don't kill eggs, so a second spraying is required once the eggs hatch. Bed bugs are also becoming resistant to our pesticides. What we really need is a pesticide that kills the bugs in their eggs, has a residual effect, meaning the bugs don't have to be sprayed directly, and is not harmful to humans. And that's a pretty tall order. So sometimes landlords rely on treatment without preparation, and sometimes they take on responsibility and the cost of preparation themselves to prevent bed bugs from spreading. Either way, they're pretty frustrated. Preparation costs can range from $600 to $2,000, and treatment costs from $500 to $1,000, and repeated treatments are recommended. The costs are all too high. High in the private sector to tenants and landlords, to social housing providers, emergency shelters, residential care facilities, and some homeowners. Some tenants qualify for the housing stability benefit if they're on Ontario Disability Support or Ontario Works, but not all qualify, and seniors and those on low incomes do not. On the next slide, as an example, is the cost to City Housing Hamilton, which manages 50% of the city's housing stock. City Housing Hamilton buildings tenants are being supported with preparation costs. However, as Susan said, the bug bed expenses are not being covered from a dedicated budget. They drain the maintenance and capital repairs budget. And this is impacting the state of the housing stock. Both the housing stock for City Housing Hamilton, for other social providers, for the private sector, and that impact is compounding. City Housing Hamilton bed bug costs for the last 3 years are at $3 million. That's $1 million a year that doesn't go to regular maintenance and capital repairs, which is a problem given the age and state of repair of some of our social housing stock. To date, efforts to control bed bugs haven't been successful. They haven't been coordinated or integrated enough. The Bed Bug Action Group has worked to improve coordination, but we need more work, and it will take a dedicated effort to create an effective strategy. The strategy will help us use the most efficient and effective methods of prevention and control, make sure that we're undertaking effective public education, that we're able to address infestations across a range of sectors and a range of situations, and that we're making the most efficient use of our resources. And the strategy ensures we're well positioned to advocate to senior levels of government for funding for bed bug remediation. And as well, the strategy will implement a critical investment strategy of the Housing and Homelessness Action Plan and respond to Mr. Cummer's ideas and concerns. So to summarize the report recommendations, the first is to direct public health services and community and emergency services to develop a bed bug strategy. Second, $350,000 of existing capital funding for addressing bed bugs to reallocate $150,000 to deal with bed bugs in the 57 residential care facilities that have a subsidy agreement with the city through the domiciliary hostel program. Third, to use another $100,000 of the existing bed bug capital funding for temporary staff resource of up to a maximum of 18 months to develop the bed bug strategy. And finally, to add a dedicated and additional $100,000 to the city's unallocated capital reserve to fund a temporary staff resource, again, a maximum of 18 months, to connect vulnerable people to services until such time as the strategy can be completed. So I want to be clear that there will be no impact to the operational levy. In conclusion, the Bed Bug Action Group, including community emergency services and public health services, strongly recommend a bed bug strategy be developed for Hamilton. And while the strategy is being developed, that vulnerable people in Hamilton receive help with preparing for treatment, and that a navigator would help connect them to services as needed. Thank you for your attention.
Thank you, Kirsten, and thank you, Susan. And I do have a speakers list, and I'll just read it off. Councillors Jackson, Collins, Marula, Johnson, Powers, and Whitehead. Councillor Jackson.
Thanks, Mr. Mayor. And Mr. Mayor, is this then just questions of the presentation? Would you keep me on the list then for my actual speech afterwards?
Yep.
Thank you very much. Thank you, Susan and Kirsten. And I also want to, Mr. Mayor, just quickly thank Rob Hall, Brent Browett, Hamida Magani, and Joe Speiler from Finance, along with Susan and Kirsten. I've been meeting with them a couple of times over the last month or so because of an issue that came to the fore in my ward, and that I'll explain later when I get into my speech. Mr. Mayor, through to Susan or Kirsten, could you quickly flip back, ladies, to some of the slides? Number 16, please. Just to quickly go back, if you can, Susan, I'll try to make my way chronologically, numerically through there from the lowest to the higher. Okay, so Susan, how about just a further explanation now? The ministry's funding ended. Was that just for Hamilton, or was that across the province through you, Mr. Mayor?
The funding ended across the province by March of 2012, so our amount was $234,000 had to be spent by March 2012.
Any explanation? I'm going to ask you to speak for the province. This is an issue. It's a growing issue, and I can't believe Hamilton's alone, and we need to be as proactive and preventable as possible. Any explanation from your bureaucratic counterparts at the ministry as to why funding was halted? Mr. Mayor, through you, please.
I don't know if Rob wants to answer that one.
Chairman.
Director Rob Hall, please.
Yes, thank you. Through you, Mr. Chairman. As a result of the funding being stopped by the province, the Board of Health was requested to send a letter to the Minister of Health, Deb Matthews, requesting continual funding. At this point, I'm not sure what the response of that minister was, but I'm pretty sure. Well, I can tell you that we didn't receive any additional funding. Nowhere in the province did anyone receive any additional funding for this, and I can't speak to why that is. But the request was made from this Board of Health to the minister.
Okay, Rob, thank you. Maybe, Mr. Mayor, at the appropriate time, we may, as we get into the debate of the report, the five-part item report, maybe we might just want to reinforce and add an up-to-date letter from your office to the minister. Slide 19, Susan, please. This is important to my colleagues. Complaints do not include homeowners. This is how I got involved more heavily on this issue. Do you realize up to now that any bed bug strategy we had primarily was for rental units and our rental units? Mr. Mayor, through to Susan or Kirsten for a comment on that, please.
Yes, through you, Mr. Mayor. Generally, the complaints that we enforce are to do with rental units. In the property standards bylaw, there's a section where it's the owner of a property who's required to keep a premises free of infestations or under control. So generally, if a homeowner calls us, we certainly offer them information about bed bugs, but we wouldn't be enforcing the bylaw to an owner generally to tell them to get rid of bed bugs because they're calling for information. However, it does mean that there's also a gap where if that homeowner needed some help with preparation costs, the program that we had at the time with the funding and now with enforcement, we have that gap. We aren't able to help them with that generally.
So, colleagues, a similar homeowner, limited income, widow, widower, barely surviving on a small pension, can't even access the same type of prep or treatment that somebody in one of our rental units can, and that's a different type of maybe inadvertent type of discrimination across our city in that way. Last slide, 32, Susan, please, to the funding, just so we're clear. And I'm very appreciative that I'd be happy, Mr. Mayor, at the appropriate time when we debate Report 7-1 to move the amendments on both C and D part, that there'll be no impact to the 2014 operational impact. But back to slide 32, Susan. So how much money did you have left over, Susan? I need to understand the 350 and the 100 there. I believe you had some money you said left over, Mr. Mayor, through to Susan or Kirsten.
Do you mean from the one time, from the 2013 capital funding?
Yes.
From Housing Services Division, it was capital money.
Yes?
So I don't know if Kirsten will.
Yep. 150 of that was allocated to residential care facilities for their addressing bed bugs, so there was a total of 200,000 remaining.
Just explain that a little further, please, Kirsten, because it might be a little bit of confusion on that. Was there some money that wasn't utilized in the last year that this is now what you're recommending it's going towards? Through you, Mr. Mayor?
Of the 350 in capital funding, none has been utilized. 150,000 has been directed towards residential care facilities.
So that leaves the 200 that today you're recommending and an additional 100 for the navigator's role.
Through you, Mr. Mayor, that's correct.
And no impact on levy if we move the amendment and it's approved.
Through you, Mr. Mayor, yes, that's correct.
Thank you for the answers to the question. Keep me on your list for speeches, Mr. Mayor. Thank you.
Will do. Councillor Collins.
Thanks, Mr. Mayor, and through you, the question I would have is relates to the multi-residential units that we're struggling to deal with, and you appropriately pointed out the resources that City Housing Hamilton is currently spending, over $1 million in 2014, and we know that there are private buildings within the city that have renters who are experiencing the same problems. But we also know that we have individual homeowners who live in multi-residential apartments. So I have a number of condominiums within my ward where there are seniors who are retiring to an apartment complex because there's less maintenance than they previously had with their single-family home. And these people find themselves in a difficult position because they are the owner of the unit, but they may reside next to someone who is renting their unit. And when they call property standards, and I've been involved now with a couple of these situations, they're responsible to treat their own unit, and they have, but they end up in a situation similar to the two letters that were read earlier where the bed bugs are coming from other places within the building. And so they're caught in a difficult situation, and the lady that I was dealing with was caring for her elderly husband, and she'd already treated her apartment, similar to the stories that we heard earlier today, 4 or 5 times. I think she had spent almost $5,000 to $6,000 of her own funds to try to rid herself of the problem. And so she was quite confident, and her pest control company was quite confident that she had done everything within her unit to clean it up, but these bugs were migrating from a different area within the building that she resided in. And so the problem becomes one, I think, related to the property standards bylaw. And so I like, certainly, and I'm going to support what's here today in terms of trying to navigate people to the appropriate, through the appropriate channels, and to hopefully gain the appropriate resources to deal with this problem. But the problem seems to go beyond that, because the property standards bylaw that we have currently forces individual units to be cleaned, but doesn't address the problem in its entirety. And I think if we were to use, I think First Place was mentioned here earlier today, we know there have been historical problems at that building from top to bottom. And if we're only dealing with 1 or 2 or 3 units per floor per month, and we know that the bed bugs then have reached to almost every floor in the building and most of the units, we're really not getting at the heart of the problem, and we're actually throwing good money after bad. And so I wonder what we're doing from a public health perspective to work with our bylaw staff to create a bylaw that essentially gets at the heart of the problem. And I know we'll never rid ourselves of it. There's a transient population. People move in and out of buildings. They may bring it from another location or subsequently take it somewhere else. But this treatment of 1 or 2 units per floor, per week or per month isn't working, and these buildings continue to have infestation problems. And in some cases, it's an epidemic. I mean, it's just a matter of time before single-family homeowners start to experience the same type of problems. And we're starting to see that. As you mentioned, it's not documented. So I'm sorry for that prolonged commentary, but it leads to my question related to the bylaw. And the bylaw seems to be failing those people who reside in these units. And I'm not certain at the end of the day that it's helping the landlords or the building owners, because they're spending a lot of money chasing their tail. So I wonder how we're addressing that issue beyond providing people the appropriate resources they need. What are we doing with the bylaw to clean entire buildings up rather than just 1 or 2 rental units out of several hundred?
So through you, Mr. Mayor, I would say that we would agree there's challenges with the bylaw, and I would anticipate, I think other staff in public health services anticipate that the development of this strategy, one thing would be to look at bylaws and whether there needs to be changes to the current bylaw or creation of possibly a standalone bylaw. There are many challenges also with tenant rights as well. So we face challenges as inspectors when we go to inspect a place, and there's rights of entry and people can refuse and they can not say they have a bed bug issue, and so there are some challenges. So we would expect that the bed bug strategy, that would be one of the focus of the strategy, is to look at whether any bylaw amendments should be made.
That's great to hear, because I think many people who've been very proactive, similar to Nicola's letter that she had written on behalf of her mother, some people have taken upon themselves to, they're caulking their entire unit, they're taping everything they can, they're painting over certain areas, they have plugs in every drain area, they're sealing up their apartments, and they're spending a lot of their own money. Unfortunately, there are tenants that we know that do not have the resources or the wherewithal to be that proactive. And so I really think the bylaw needs to address buildings on a site-specific basis rather than a rental unit basis. So I really appreciate what you have here, because I think it's one of the most important issues that the city and others, as you've mentioned, will have to deal with over the next couple of years. It really is an epidemic proportion right now in certain areas of the city, and it looks like it's only getting worse. So thank you for that opportunity to speak, Mr.
Thank you. Councillor Marula.
Thank you, Mr. Mayor. And just on the point of this being more of an issue, not only today, but in the future, that we need to address, I think that we're looking at potentially an epidemic in the future if we don't get ahead of this in a proactive manner. And in just researching this and understanding how it can spread and how quickly it can spread, what are we doing as a city to engage the province, who obviously, as Councillor Jackson has alluded to, are basically backing away from the issue rather than pursuing it? But more importantly, what are we doing as a country, Health Canada's position on this particular item, and how we're going to deal with it via the federal government? So through you, Mr. Mayor, any indication where the federal government sits on this issue?
Through you, Mr. Mayor, I'm aware of the National Collaborating Environmental Health Group. They've done some collection of information about how different communities across Canada are dealing with bed bugs and what the gaps are and the challenges. So that occurred last year, that survey. The outcome of that survey, I'm looking forward to see what might come from that. At this time, we have not heard any word from the federal level of Health Canada about addressing bed bugs in any specific way. So it's just this survey that's been taken to kind of get a snapshot of where communities are with bed bugs, but I've not seen anything come out, and I would just see whether Dr. Richardson or Dr. McGanny has seen anything. I have not heard of anything from the federal level yet.
Okay. Now, with respect to comparisons to other jurisdictions, other countries, or so on, who would be considered from a best practices capacity to be dealing with this in the best way?
Well, one of the challenges is that we need someone dedicated to look at this and develop the strategy to actually answer those type of questions, to look across the globe, to tease out what are the best methods, what does work, what doesn't work, and what could work for Hamilton. So I don't have all of those answers yet. We need that information gathered.
Okay, through you, Mr. Mayor, but would it not be far better to have a national and provincial strategy rather than having cities work in silos on an issue that obviously is more international than it is local?
I think that's a general question or general comment that provincial plans or federal plans could work better. This is our starting point for Hamilton, through you, Mr. Mayor, to develop Hamilton's strategy. Maybe we could become the model that others would adopt. Certainly, bed bugs are not to the same level in every community, and so it's hard to maybe have a provincial plan that's one size fits all for every community. You have to look at what the issues are locally. Not everyone is at the same level we are for bed bugs at this time.
And through you, Mr. Mayor, why is that the case? What variables, the top 3 variables that contribute to an increase of bed bugs?
I believe some of it is that, where more people are congregated and where there might be more multi-unit dwellings, where the bed bug can travel around. We also need to look at that as well through the strategy, maybe factors that are contributing to our issues here. We've had a dramatic rise, Toronto had a dramatic rise, Ottawa has a dramatic rise, so it certainly is happening. And there are increases. It could be climate change, the different reasons of why it's now in Ontario more than it used to be, could be something to do with that as well as the global travel. But there's some questions we still don't have the answers for.
Now, in this particular initiative, are we formally, as a council, endorsing or engaging the province and the federal government to be more engaged? And if not, why aren't we? Or should we put it forward more direction today?
Yeah, through you, Mr. Mayor, I would recommend the latter.
Okay, so at the appropriate time, Mr. Mayor, I will move that accordingly.
Fine.
Thank you.
Thanks, Councillor. Councillor Johnson, Powers Whitehead. Johnson.
Thank you, Mr. Mayor, and thank you, Susan and Kirsten, for the presentation. Most of my questions have been answered. It was just a couple that the gentleman standing before us was asking, and I just wanted to follow up on some of them, if you don't mind. One of the things that the gentleman said was it cured the bed bugs, got rid of the bed bugs, but didn't get rid of the cockroaches. So am I to assume that there's a particular treatment only for bed bugs that are different from cockroaches and other pests?
Through you, Mr. Mayor, depending on what bug you're going to be tackling, they have different levels of pesticide. So if they were successful for the bed bugs, that's great. It may also be that particular treatment, the preparation was well done, and they were successful in killing off all the eggs. It may be that they missed some of the areas for the cockroaches.
Okay, thank you. And one of the other things that the gentleman suggested was similar to what we have in front of our restaurants. Do we have the ability, or have you thought about putting out the red and the green and the yellow cards for the apartment buildings to give people a heads up when they're coming in to rent? Or other buildings, not just rent, sorry.
Through you, Mr. Mayor, when Mr. Cummer came in September, we did bring the issues forward to the Bedbug Action Group for discussion. We reviewed the different ideas, and while we are interested in them and see merit in them, we really need the focus of the development of the strategy for someone to take a good look at it, to then come back as part of the recommendations from the strategy to respond to these different ideas about what's feasible, what the model might look like.
Thank you. And one last question, and Councillor Collins touched on a little bit, and it's the holistic view. If we're taking care of this within our own Hamilton housing, and we have rentals that are beside us, or homes beside us that are also infested, where do the landlords come into this? Is this where we can actually put something down, as Councillor Collins, I was thinking, was alluding to, that the landlords take some ownership to this as well? Because we're landlords to a big chunk of housing out there. We're willing to do our part. And as it was said earlier, it almost could be on the epidemic proportions eventually. What jurisdiction or what can we put into place to get the ones who are renting out or owning property that has this infestation?
Through you, Mr. Mayor. So we have in the pest bylaw, the section of the property standards bylaw, it is the landlord who is responsible for dealing with the infestations. Now, it can't really be pest free, it needs to be controlled. So we do enforce the bylaw, and certainly there are many landlords that want the bed bugs out of their place as well. They are spending thousands and thousands of dollars. So yes, it doesn't just go, stop at one building. saying, it is a community issue, and that's why we need a good strategy to all get our heads around what really needs to be done as a collective for us all to combat this bed bug.
And I totally agree. Thank you, Susan. And thank you, Mr. Mayor, for your time.
Thank you. Councillor Powers.
I have one question, and then please put me on the list for comments also. Please explain the navigator position. I tried to comprehend it from what was written, and it's pretty vague. Help me with the navigator position that you're proposing.
So, through you, Mr. Mayor, in the previous process with the one-time funding, it was a good system where we had funding to help cover prep costs for a tenant, and also some resources to cover their mattresses. What we're finding, though, is that people have difficulties grappling, especially if they're vulnerable, if they're elderly, if they have any mental health issues, if they have other issues. This is one more thing on their plate to have to deal with, and they struggle, and it's time-consuming, physically exhausting. So this is a helping hand. This is somebody to be there, that if you need a form filled out for your landlord to get the process going, if you need connection to some crisis counseling, if you're not able to, it's to help support them through the whole process, to deal with the bed bugs. Some issues we have gone to a unit where it's supposed to be ready for preparation, and the tenant, it starts to take items out of bags that have been put away. So they're undoing the work before treatment can happen. So they're taking things out because they're not understanding that you can't get at your items until treatment is all the way through. So a navigator would help support that person, explain the process, possibly look at if they could stay with friends or family. Like, it's someone really to just help them through the whole process.
Thank you. Councillor Whitehead.
Thank you, Mr. Mayor. I did a quick bit of research in regards to Europe and Denmark, and they've been tracking this issue much longer than in North America. In fact, they've been tracking it since early 50s. And according to their numbers, it's been cyclical. So in fact, in the 50s, there was a peak, it came back down, and it went back up, I believe, in the 90s, and then it came back down, and now it's on the rise in the last 10 years. One of the things they attributed to is because of the opening of borders and more transient people moving around, they're bringing some of the bed bugs, for example, in Denmark. So they're attributing to the carrying of the bed bugs into their particular country as a result of the opening of the borders. But the things that they had, and they said they got lax on back in the 50s now, is they had a bed bug registry in Europe. And again, they make it clear this is not about individuals. This is about trying to eliminate the bugs and transference of the bugs. Have we contemplated, or do we have in place a bed bug registry?
Through you, Mr. Mayor, we don't have a formal registry, no, and that was Mr. Cummer's, one of his ideas was to look at maybe having a registry. If we have a registry, if we went down that road, we would really need to be sensitive about how that would work, and so we really want to focus and have someone develop the strategy for bed bugs, and that would be one component, to look at whether a registry would be helpful in the long run. Is it a good idea to say this building has bed bugs and this building doesn't have bed bugs, or this building is controlling their bed bugs? Is that going to target any particular populations? Is that going to cause more stigma to some people in the community, or is it going to help? So these different issues need to be reviewed.
Well, and I appreciate that. What I read, and of course, they've had the registry up and going, and had sort of a comprehensive plan around that registry for a number of years in Europe. And it wasn't about the sensitivities you talked about. It was about control. So when you know where the bed bugs are, it's about ensuring that they're not being continued transferred and expanded in regards to the scope of the problem. And they found when they laxed on that program is when it started. They believe that's part of the reason why it's taking off again. in Denmark, for example, in the last 10 years. So there is talk about tightening it up and ensuring that they know where the bed bugs are, and they're doing everything they possibly can to ensure that not only is it taken care of in that location, but it's not being transferred to other locations. And that's the key, because you can fix one problem in one area and then end up having the problem in some other if you don't have those kind of controls. And that's what they, that's how they're looking at it. The other thing they talked about was through their experience since the 50s. They were looking at different pesticides that are being utilized, and they looked at pyrethroids. Pyrethroids, thank you. That they said wasn't the most effective way of dealing with bed bugs, but they had huge success, or a larger success, with, is it chloropyrifos? Am I pronouncing that wrong? Right?
I'm not sure.
Chloropyrifos. Anyway, probably pronouncing it wrong, but it was a different chemical, but they're not applying it in Denmark for whatever reason at this point either, but their studies had indicated that it was a more effective way of dealing with bed bugs. So I'm not sure what the other downside of using that particular chemical, but they did find a chemical that certainly had much more effect than the one that we just identified. Where are we at with the exploration and the experiences of other jurisdictions to look at what the best type of pesticides to use?
So through you, Mr. Mayor, Ministry, so pesticides are approved across the country by the Pest Management Regulatory Agency. So only certain products are approved for use in Canada. And then in Ontario, the Ministry of Environment also sets their approval levels. So there's only certain products that are approved in Ontario. As I said in the presentation, unfortunately, Ontario and Canada is not a huge marketplace compared to other parts of the world, including the States. So there may be other products that may work better. However, they may not be licensed in Ontario because there may just not be a market by those companies to bring them here.
Yeah, and I appreciate that. And the other thing they identified is that there are different strains of bed bugs.
Pardon me? Excuse me.
Are there different strains of bed bugs and different sensitivities in regards to depending on what jurisdiction you're dealing with?
Through you, Mr. Mayor, there are bed bugs that actually can infest bat caves. They actually think that that's where our human bed bug originated, started out as bat bugs. So there are other types of bed bugs. For Ontario, certainly if someone brings in a bed bug locally, we can identify what type it is. Generally, we've only been seeing the same type of bed bug here locally.
Great, appreciate that.
They're very resistant. They've got a hard shell.
Europe is well ahead of us in addressing this issue. It's not just a North American issue. It seems to be an international issue. And obviously we need the resources to apply best practices to deal with this infestation. Thank you.
Thank you. I have myself on the speakers list, then Duval, then Morrow, then Clark. Councillor Partridge, Deputy Mayor, please.
Absolutely, go ahead.
Thank you. Through you, Deputy Mayor, what does it take for the province to get involved? Looking back, for instance, at SARS. And so what we needed in that case was a coordinated approach, which is what occurred. Although no one's dying from the bed bugs, apparently, according to the evidence, there's tremendous psychological harm that's being done. And I've seen many, this started before 06, because when I came into council in 04, that was the first big thing, and it seemed to be just breaking out at that time, even hotels in New York, five-star hotels and all this stuff. So, what would it take to engage the province in a coordinated approach to this? And I agree with what some other councillors have said already with regard to that. So, what would it take for the province to listen to a submission from a municipality to get involved in a coordinated approach?
So who would like to tackle that one?
Through you, Madam Deputy Mayor. I think in talking with Councillor Jackson about this, one of the things that we've shown in the past is that sometimes it takes municipalities to be the leaders in certain areas to almost get the attention of the province. So when you look back at certain issues that we always wanted the province to take a lead in, but they were hesitant to, it was the municipalities that stepped up. Smoking bylaws, which led to a provincial law. local pesticide bylaws, which led to a provincial law. I think through this strategy, we'll be able to engage the province through some recommendations through this Board of Health and through Council to try and get the province on side. But I think we need to start by having a comprehensive strategy so that we as a community can tackle this issue together and lead the province into coming up and helping us in the future.
Thank you. So that's helpful to us, because what I'm hearing then is we have residents who have needs. We're going to do our best, and in doing our best, that may be the stepping stone to further approach. Thank you. Thanks, Deputy Mayor.
All right, thank you, Mr. Mayor. And if you can add Councillor Whitehead for the second time.
I just have one question I forgot to ask. It was on my list. The federal government.
Excuse me, we do have a speakers list. So if we could come back to that, and we'll put you down as a second-time speaker. Thank you. Back to you, Mr. Mayor.
Thank you. I have Councillor Duval, Morrow, Clark, and Whitehead for a second time. Councillor Duval.
Thanks, Mr. Mayor, and thank you for the presentation. Some of the questions I have is the prep time. Do we have experienced people? Because I know some of the services that we're delivering through Hamilton Housing, they want them to prep the rooms themselves, and some don't have the ability to move furniture or do that type of stuff. And then what happens is they'll get a couple of people, just, go move some furniture. And then what happens is they start stacking the furniture out in the hallway. They're making room. And then the bed bugs are actually being infested into the carpets, going into the next room that wasn't even infested. And we're treating one, but we're causing another problem to another. So there's a lot of lack of experience out there, even though we're trying to do the best, but we don't have the properly trained people to actually isolate this into a room. We almost have to do the whole floor of the building, like Councillor Collins was suggesting, because it's just leaping from one room to another. Do we know of experienced people, or are we just doing this by, we're looking after the complaint, and we're not actually educating the people what to do?
Okay, go ahead.
Through you, Ms. Deputy Mayor. Certainly you've touched on a major problem, which is public awareness and education and the knowledge of the public generally. That's certainly going to be a major component of the bedbug strategy. There are people in the community that have the experience for preparation. For instance, Good Shepherd Works has in the past at least done a program of preparation and treatment, and there are others as well.
Councillor?
Yes, and I know Good Shepherd had a great program, and then we went to another facility in Hamilton Housing because it got cheaper, and let the tenants prep it. And so I just think we're going a step backwards, because all we're doing is spreading it over and over again. It seems to be a lot of money being spent on this, but no real idea of how to control the problem. I know that your navigation that you want to implement is great, and I certainly support it. I'm just trying to explain some of the problems that we're having in Hamilton Housing. And it's the same with street furniture. Some people will trade furniture, and it goes one to another. People that share the same laundry facilities, they have it in their clothes, they have it in their towels, and they go down to the facility to wash their clothes. It's going from one to another, and it just seems to be there's no control whatsoever over this, and it's just not a Hamilton problem. This is an epidemic going across the country, because I go to the FCM meetings a lot and listening to other people. Municipalities are having problems. The bed bug is growing, and there's no real cure because these pesticides are being banned. And I don't see anybody leading the situation with other levels of government. We have a serious problem. Everybody's just throwing money out and hoping to get rid of it, but it's just growing and growing.
Through you, Madam Deputy Mayor. Yes, you certainly hit on a lot of the complexity of the problem. It's a very difficult and thorny problem, and we hope the strategy will at least come out with the best practices and the best thing that we can do.
Councillor?
Well, I appreciate that, and I'm certainly going to support it because I know that we need somebody to lead this charge because to the other levels of government, because municipalities are running out of funding. We're taking that funding out of people that we operating costs, the stoves, the fridges, and that's what it's coming down to. And it's just we cannot defeat them. We just don't have a solution yet. So we need other people at the table. Thank you.
Okay, thank you, Councillor Duval. And next is Councillor Morrow, please.
Are you aware of a federal government survey that was concluded last September? I've been told about on bed bugs, and I'm wondering if you know anything about it or have heard of it. Were we a part of it? And are there results from it that might help us now?
Through you, Deputy Mayor, I spoke before about the National Collaborating Center for Environmental Health. That's a federal level survey that did go out, so I'm not sure if it's the same one you're speaking of. This one was addressed to health units across the country, so I'm not sure if you're talking more about a public type survey.
I assume that the one has something to do with the other. So you say health units across the country, we were involved or invited to submit information?
Yes, through you, Deputy Mayor, the Director of Environmental Health was requested to fill out the survey across all health units across Canada. So we did submit from Hamilton with input from our bedbug advisory group on what we are doing locally and where the gaps are.
Councillor?
Okay, Madam Chair, can that be brought back to us now? Have they concluded?
They did conclude the survey, and we did get results. It's just kind of a snapshot of these are the broad issues. They don't speak directly to any solutions, just what the gaps are.
Councillor?
Thank you. Secondly, I was glad to hear First Place mentioned. It is in Ward 3. I've been contacted there to try to help with a difficult situation involving some people who used to be associated with the city and whom I knew. Are you involved there adequately? I know we have many buildings, and it's one of many of the city's concerns, but it is a large, busy place, and I know there's been a problem.
Through you, Deputy Mayor, we're connected insofar as it's a City Housing Hamilton property, and so they have their own in-house program, but we certainly are informed about it through the Bedbug Action Group and discussions with them.
I guess as a newbie here, would I best go to management there or to you for information that I might find helpful? Brian says come to him, so
I think the councillor, beside you is, I think you're in good hands. Yeah.
Thank you.
All right, thank you, Councillor Morrow.
I'll just rephrase my question. Should I go to them or to Brian? And now I know.
All right, would someone like to respond to that?
No, I think he already has.
He already has? Well, and I've got him on the list so he can come back to that. Next, I'll go to Councillor Clark. Please, Councillor Morrow, you're done?
Yes, thank you.
Yes, okay, Councillor Clark, please.
Thank you, Madam Chair. Just turning to page 2 of 11 of the report, we're indicating in item C that the pilot for unit preparation is for low-income and vulnerable residents. And then in item D, we're talking about vulnerable residents, but not low income. And I couldn't find what we would define as the definition for either of them. So what would that be? And because I'm sure the residents are going to be asking, do they qualify? And I can't answer it based on what's here.
Okay, go ahead.
Through you, Deputy Mayor, it's a good point because in discussions with Councillor Jackson before the report, some questions did come up about what would vulnerable residents mean, and we want to certainly be inclusive for our community and help people who are not only just renters or tenants. We want to look broadly and look at all vulnerable residents. So the idea I think we would be looking at would be to include people of low income. So that could also include people who own a property, but also if they are senior or have physical limitations. So we could certainly develop a set criteria if the recommendation is approved.
Councillor?
Okay, so we will be setting in essence, a cutoff, if you will, in terms of low income and the definition of what vulnerable would be. So that would be a report back if we proceed.
Through you, Deputy Mayor, in the previous one-time funding, the province kind of set out what the vulnerable criteria was, so we weren't able to have any leeway. This time we could have leeway, and so we can look more broadly to come back with a different criteria.
I'll look to my colleagues. I mean, my preference is always to really understand what the definitions are before we actually pass the recommendation. Because I think we should all be on the same page in terms of exactly what the qualifications are, what the criteria are, but I'll see what my colleagues have to say about that. The idea of the registry, which has been brought up a couple of times today, does the office or the public health office have a registry of where they're having issues? Are you keeping some formalized registry that way?
Through you, Deputy Mayor, through our complaint program, we have street file information. So we have a database that would list all the different addresses where people have complained. In-house, we're looking also at just mapping those areas. But again, that would be more for internal purposes for having staff go to address those different concerns. So we don't have a registry, but we have a database of complaints.
Councillor, I think Dr. Richardson would like to add to that discussion, please.
Yes, thank you.
Through you, Madam Chair. Just to clarify the issue of the low income and vulnerable, and Jillian can speak to it further in terms of recommendation C. So they do use the LICO cutoff for low income citizens. And if you'd like further, we could have Jillian add to that. For the piece for the public health piece with the navigator, we didn't put low income in there intentionally because vulnerable individuals may or may not meet that cutoff. The income piece is one piece alone, but there may be other reasons for it. So it's meant to be more vulnerable in terms of people who are really having a challenge working through the issues that they face, and taking that from what our experience has been the past couple of years.
So if I can just address that.
Yes,
to the
absolutely.
doctor. So if we're going to use the LICO as the cutoff and I guess the basis of the province's program for the definition of vulnerable, does that give you then sufficient flexibility to make sure that you're not missing any vulnerable people?
Through you, Madam Chair, I think so, and Jillian's just nodding that she does as well. I think if we found after a couple of months that we were finding we did have a challenge, we would come back to the board to discuss it further.
Okay, so I'd be comfortable with that. I looked at Councillor Jackson, but at least we have a base in terms of how we're starting out, and it provides some flexibility for our staff. With regards to the registry, there's different types of registries. There's a registry that's a very public document that anyone can get, and there's also registries that are not a public document that are specifically used by enforcement divisions of a government. So we could set up a registry for the city of Hamilton, and it would be meant for public health. It would be meant to track in the long term, so we can actually get a handle on whether or not we're being successful, because it's not simply eradicating, we're actually preventing the spread of the bed bugs. So I'd like your opinion on that type of registry as opposed to one that would be public.
So through you, Madam Chair. So I think what maybe you're speaking to is more almost like a surveillance program then to look at trends and changes. And certainly through our mapping processes and our database, we could look at gathering that information and looking at it from a surveillance standpoint.
Okay, thank you, Councillor.
And the last question was the issue of notice signs that's been suggested a couple of times. I heard you comment about it potentially increases the stigma, and there's no doubt that there's significant stigma with bed bugs or any pest infestation. But have we looked at the legal implications of that type of program where you'd actually be publicly saying to people, this apartment's off limits. It has bed bugs, could be on the main floor, but because the sign goes up, there's going to be responsibilities and potential liabilities. So have we considered that at all?
Through you, Madam Chair, we haven't considered that, but again, that would be one aspect that we would look at through the development of the strategy. If that was going to be something that was recommended to go forward, we would have to look at the pros and cons, and that would be one thing, is to look at any legal liability.
But to be clear, that was not a recommendation of staff. That has come up in discussions, I'm assuming.
To look at the legal liability now.
The notices on the buildings.
Oh, I mean, if we're going to be doing any enforcement through the property standards bylaw, I'm asked for clarification. I'm sorry.
The earlier questions were about having a notice sign, a yellow sign indicating that there's bed bugs in the building or something to that effect. At least that's what I understood. I'm asking, that was not a part of your consideration, that came from another party?
Yes.
Councillor, was that something that was raised by another councillor, or was it raised in your presentation?
I believe it was raised by Mr. Kummer.
Okay.
Originally in September.
Sorry, I wasn't here for that part of the discussion, but Councillor Johnson, I was, yes. Go ahead.
So we took the different suggestions of Mr. Kummer to the Bedbug Action Group for discussion, and we felt as a group that we couldn't make any decision or action to go for a registry because of different concerns and issues, and we really wanted somebody to help develop a strategy and look at the registry as one possible component for a Hamilton program. So apart from bringing it to Bedbug Action Group, it hasn't been looked at further at this point.
So I'll just take it there's been no further action on that and no recommendations from public health then. So I'd be happy to, if we could at somewhere in here just indicate, Dr. Richardson, that LICO would be the low income cutoff, and that the starting definition for vulnerable residents would be from the one-time provincial funding program that was set up earlier, and that gives you the flexibilities to broaden it from that point forward. But that gives us a starting point. Okay, thanks.
All right, thank you, Councillor. And would that be an amendment? Okay, and Councillor McCaddy, please.
Thanks, Madam Chair. Great work on this, obviously, and special thanks, and I've already thanked her, to Nikki in my office, and for spending the time on this. Her personal experience was, as you read out in that letter, was very, very difficult, and I kind of had the play-by-play as that evolved, and it was a very scary situation and very damaging for the whole family. Madam Chair, I just have a bit of a concern about the strategy itself, so I'd like to just get a better sense of what you see being in the strategy. As my sense is we are undertaking a lot of the best practices here in Hamilton already through City Housing Hamilton, just because we've had to, given the magnitude of the problem that you've identified in your slides. So we get a lot of strategies that come back to the Board of Health or City Council, whatever standing committee it might be, Madam Chair, and they identify all the stuff that needs to be done, and it ends up being quite an overwhelming document that comes back, and there's often large amounts of money associated with it. I'm thinking about the housing and homelessness action strategy, which we have, which is an excellent strategy. And it's been my experience, just thinking about the Poverty Roundtable, for example, we identify the problems, we come up with solutions, but the ability to implement those solutions is very much limited by the amount of money and wherewithal we have. And Councillor Marula mentioned a moment ago, I think the Mayor mentioned the need to talk to the province and the federal government, Councillor Duvall, through FCM. So I'd like to see a significant part of that strategy be talking to the federal and provincial governments and the associated ministries and departments that you would need to touch base with. Because what I don't want to see is a strategy coming back saying do all these things, and we just kind of look at each other and refer it to the probably 2015 budget by that time, and we have a big long discussion again. So I think it's not, I'm digressing here, but I think of the Hamilton Harbor Remedial Action Plan, where the federal government, the province, and the municipalities were at the table right from day one, and they developed the plans jointly, the strategy jointly, but also committed to dollars for each part of it, and of course implementation is happening. In that case, Poverty Roundtable, nothing like that. It's a City of Hamilton driven process. Wonderful things, great strategies. Implementation is lacking because of the absence of the province and the federal government. So, Madam Deputy Mayor, Madam Chair, I wonder if we can, if I can just provide that direction, I guess, at this point, that a key part of the strategy, beyond looking at best practices, which I have the sense we know quite a bit about, and how we would do it in Hamilton, may not be that much different than elsewhere. So I'd hate to see a strategy coming back that kind of duplicates what's occurring elsewhere, and doesn't have a lot of innovation to it, just because there isn't a lot of innovation out there. But it really has a whole big section about what we've managed to learn from the Deputy Minister at the appropriate Ministry of Housing, Municipal Affairs, wherever we want to go, health, I guess. And I'd be happy to talk to staff more about that afterwards. I mean, it's almost a government relations exercise, but that can be done at the staff level when it's a staff strategy. It needs to be jointly pushed and implemented through the politicians. But I just would hate to see something come back that says do all kinds of stuff, and we know what City Housing Hamilton is spending $1 million a year just for our portfolio, and that's coming down the last 2 years. Actually, is the good news. It wasn't necessarily up there. We're doing it more efficiently and a bit better than we have in the past. It's some good news, but it's still incredibly high. So I wonder if I can leave that with you as direction. Thanks, Madam Chair.
All right, thank you, Councillor McCaddy. So you'll take part of that offline, and staff will take that as direction. Okay, thank you. Councillor Powers, please.
Just a couple of things. Number one is that, and I'm just going to be critical for a second, I think there should have been a joint report with bylaw enforcement here. I think the fact that you've agreed that there should be some suggestions for strengthening the bylaws that allows us to get involved in households or residential units is, I think was, and I'm being helpfully critical by saying is a better report would have been one that would have combined the efforts of bylaw enforcement to allow us to move forward, and we could probably start those things sooner before we actually got into this. So, but we anticipate that probably in a supplemental report coming down. The other thing, in building on what Councillor McCaddy has said, one of the directions that we've taken as council and correspondingly for the city is to seek out logical partners. And I think what's being contemplated here and the cost, even though they're reasonable, is even though we're an older established city, is like people in London or people in Halton, they all have bed bugs too. So maybe if we were to focus our attentions and our resources, that's dollar-wise and maybe staff-wise, in order to come out with a plan that's probably, 80% of it is beneficial to every one of the communities, we can, put our resources together in order to do the thing. I'm not going to stand in the way of the report. I think the way that you've written is very, very positive. The way that you're going to self-financing it is great, but to take it to the next step is going to require investment by not only ourselves, but as Councillor Marula alluded to, the other recognition by the provincial and territorial governments and the federal governments that this is in its own way, a pandemic that has the chance that it'll happen. So the report's good. Your presentation was excellent, very, very helpful in that. I'm just trying to be a little bit more helpful. Thank you, Susan, and thank you, Kristen.
Okay, thank you, Councillor, and I have no further speakers. So before I get to the second time speakers, to comments, you're right. I'd just like to remind everybody that apparently we're supposed to be out of here at 3:30, which is about 5-10 minutes from now. So no problem. Now, I don't know where the comment list is, so it's not written down here. So So I do recall it was Councillor Marula, Councillor Jackson. Anyone else? All right, folks, go ahead. Councillor Marula, please.
Thank you, Madam Chair. Actually, in all honesty, I must defer to Councillor Jackson. I didn't ask to be on the list, but I will be asked now, though, formally to be put on the list.
So I'm officially taking you off the list.
I have to defer. I was only kidding when I said I was first. I didn't want to pull a Whitehead.
Councillor Jackson, please go ahead.
Thank you, Madam Deputy Mayor. Thank you, Councillor Marilla. So I promise in all seriousness, as Susan and Kirsten had shared a couple of real-life stories, Mrs. IMAKS, from my ward on Fennel Avenue, told me her hardship case, and I want to share it with all of you quickly, Madam Deputy Mayor. That's why I reserved the right, and it's not your fault with the mayor, to come back on the speakers list. I want to share her story. About a month and a half ago, quickly, she called up the city public health because she has a PSW and she doesn't know where it came from. She's lived in her home for 50 years, and just in the last month and a half, whether it was the PSW, whatever, she woke up the next morning, she's got these little apple seeds, which are the bed bugs as they start and as they're described to me. She calls up Public Health within its realm says, sorry, Mrs. IMAKS, basically nothing we can do, no funding, etc. And she's on low income, she's in her 80s, she's a widow. One son lives outside of our jurisdiction, can't come here all the time. And so just like on seniors bus passes, Madam Deputy Mayor, just like with the Helping Hands program, Snow Angels, we don't say to somebody, oh, if you're a renter, we're going to help you. But if you're a homeowner on the same type of low income, we won't help you because you're a homeowner. So to me, that was a huge gap, and one that I'm glad that the C part of this recommendation, along with Councillor Clark's sage advice as a starting point, is worthy and was most important to be included. I'm glad staff included that because that was a huge gap. And so Mrs. IMAKS called up. Basically, staff said no. She calls my office, and through Dr. Richardson, through Bill Atanas, quite frankly, and community services, they found creative ways to help both with the prep and the ultimate treatment. The fumigator was going to charge for 3 treatments, Madam Deputy Mayor, a total of $900 total, $300 per. We got him to reduce it by half, which that was very magnanimous on his part, and staff were creative to help us through this whole process. The stigma of it, her friends from the church would no longer come to her home for that several-week period because of bed bugs, and, you know, quite honestly, the scare of, geez, you know, we want to visit you, Ms. IMAKS, but maybe that's going to end up, we're going to leave as well with the same problem taken back to our home. That whole stigma is an issue that cannot be talked about enough, along with the problem itself. So, Madam Deputy Mayor, this is, I thank Mrs. IMAKS, and she was just in tears of joy afterwards, thanking Public Health and Community Services, my office, for helping her through and getting rid of the problem after 3 treatments. And as well with her low income, we found a way to look after the costs. So, Madam Deputy Mayor, this is a very important preventative, proactive strategy moving forward. City Housing Hamilton, Library, Good Shepherd, everybody is trying to, within themselves, do good work and try to help to eradicate, but we need this comprehensive strategy. And at the appropriate time, thank you for allowing me to share that story. At the appropriate time, I'll move that the D&E part be absolutely no impact to the operational levy. And I would like to add an F part that the Board of Health, under the Mayor's signature, send a reminder letter of reinstating the bed bug funding, which ceased in 2012, and copy AMO. Thank you very much, Madam Deputy Mayor.
Okay, thank you, Councillor Jackson. Now, I don't have anyone. I took you off. You're back on.
And now I'm requesting to be back on.
All right, now you're back on. Go ahead.
Thank you, Madam Chair. With respect to the motion that I wanted to bring forward, engaging both the provincial and federal government, I think what's important in including this, and I'll include it as a friendly, if need be. I don't know who's moving this. Tom, Councillor Jackson moving this motion?
I believe, is it Councillor Jackson and Councillor Powers?
Oh, okay. So if we can just include, and I'll accept a friendly amendment to it, to ensure that the province and the federal government are engaged with respect to a province and national-wide strategy to deal with it. It seems to me to be foolhardy to have everyone work in silos throughout this country, city by city, town by town, when there should be a provincial national strategy. So as a direct result, if we can include that accordingly, that'd be greatly appreciated. Thank you.
Include that as well. Do you have that, Madam Clerk? Yes. Councillor Powers, please.
Sorry, just on that point, is the reference was to AMO. I think because it's federally too, it should go to FCM also.
So we'll include FCM on that? And AMO. All right. So that's moved by Councillor Jackson, seconded by Councillor Powers. All in favor? Carried. Thank you. And motion to no, sorry. Yes, go ahead, Councillor Jackson.
Madam
Sorry.
Deputy Mayor, everybody should have a yellow sheet in front of them, moved by myself, seconded by Ward 7 Councillor Scott Develle, that the D part and the E part of the staff report 7.1 be amended to include without impact to the operational levy on both parts. Moved by myself, seconded by Councillor Develle.
All right. All in favor, please?
Carried.
Anyone opposed? No?
And
Okay.
Madam Deputy Mayor,
Yes.
the F part, that the Board of Health, under the Mayor's signature, send a reminder letter of reinstatement of the bedbug funding that ceased in 2012. Moved by myself, second by Councillor Marula.
All right, all in favor? Carried. Anyone opposed? No? Okay, thank you. Now, may I have a motion to receive the presentation from Councillor Clark and Councillor Pearson? All in favor, please? All right, that is carried. Now, Madam Clerk, I am going to turn to you because we still have quite a healthy agenda in front of us and we need to vacate the premises. Comments, please? Microphone?
Does, Madam Chair, do you believe that items 8.1 and 8.2 could be received, or?
Okay. All right, so, and then past that. So that's going to be moved by Councillor Clark, seconded by Councillor Johnson for item 8.1. All in favor? To be received. Thank you. For 8.2, moved by Councillor McCaddy, seconded by Councillor Powers to be received. All in favor? No one opposed? Thank you. Now we get to the motions.
Thank you, Madam Deputy Mayor.
Go ahead.
It's moved by myself, seconded by Councillor Collins. I'm not going to read what's before us in its entirety, but it's related to the Active and Sustainable School Transportation Charter. And in meeting with staff, Ellen Pizzetta and Kelly Scott, months ago, I was looking at a strategy to deal with what is becoming more and more of a problem, particularly in the older part of the city, with congestion of vehicular traffic in and around public schools and high schools, particularly public schools or elementary schools. And in combating this particular dilemma, it's going to only get worse as a result of the school boards not incorporating a strategy to deal with this very issue from a policy perspective. In that when you close a school, what in essence occurs is now you're increasing the length of, or the kilometers necessary to get to the new school, which in essence increases travel time, which then puts more of a demand on vehicular traffic as opposed to pedestrian means of getting to school. In saying this, we need to look at a local strategy, but more importantly, we need to have the school boards work with us on that strategy to incorporate a formal policy, which at present they do not have at either the public or Catholic board. And what this basically does, it allows us as a public health department to work alongside our colleagues at the school boards to ensure that not only is this on the agenda, but that a formal policy is established to combat what is going to become more and more of a problem in neighborhoods throughout the city, particularly in the inner city where we're seeing school closures. So in finalizing this, I just want to thank staff for their assistance and their thorough involvement, particularly from Ellen and Kelly. I was very, very impressed with the work that they put towards this. And the school bus, or the mobile school bus idea, or pedestrian school bus concept, is where this all began, and to try to deal with the neighborhood crisis that we're faced with in a number of neighborhoods. But it was expanded to include this Active and Sustainable School Transportation Charter. And for that, I just want to thank staff once again, and look forward to your support. Thank you, Madam Chair.
All right, thank you. And Councillor Clark, please, on this item.
I just wanted to thank Councillor Marula. Reading the motion, we're performing a role of a facilitator, which I think is fantastic. If we can get them on the same page and move forward, it's an excellent plan. So, good job.
Now, I'm sorry, one other thing that I mentioned, I appreciate that, Councillor Clark. I do want to advise everyone that when we established the the Joint City Board Relations Committee. We didn't include the Catholic Board, so we're going to formally have to do that. And I'm wondering, through you, Madam Chair, to the clerk, would that be perhaps a sage action today, just so that we're not excluding the Catholic Board?
Okay, Madam Clerk, please.
Yeah, I believe you could do that by motion to
Today.
include them.
Okay, so if we maybe include that within this, so I'll move that, seconded by Councillor Whitehead.
Whitehead.
And that'll be included in this one as well.
Okay, and all in favor? And that's the amendment, and on the main motion, please, though that's moved by, oh, sorry, we did have a speaker, Councillor Whitehead.
Just quickly, I mean, I want to thank Councilor Marola for showing leadership on this. There's no question that it's creating more stress on neighborhoods in regards to more vehicle traffic. And the inability to address that. It's a complaint that I'm sure many of us receive over and over again from residents that live in neighborhoods. So I want to thank Councilor Marola.
Okay, thank you, Councillor Whitehead. All in favor? Carried. Carried, thank you. Any notices of motion?
Madam Clerk, just quickly, the notice of motion is before you. It will be seconded at the appropriate time by Councillor Morrow, but today it's just a notice of motion, and it's related to the Ottawa Street Mobile Farmers Market, which is a 2-year pilot project. This will lead to ultimately a report and further consultation with all members of council related to what's before you, which clearly outlines the intent. Attached to this will be also a report, and we'll go from there.
Councillor, it's a notice of motion, so we don't need to speak to it. Okay, thank you.
I know, but I felt the need to.
I know. That's what I get for putting you back on the list. All right. General information business, we have items 11.1 to 11.5. If we don't have any discussion on them, I'll move to receive. Councillor Powers and Councillor Jackson, all in favor, please. Thank you. Anyone opposed? No. Private and confidential, Madam Clerk.
Yes, sir. I'm not sure if staff need to have this approved today or if it can be deferred to a future meeting.
I'm seeing from Dr. Richardson that we do need to have this approved today. Dr. Richardson, do you want to make a comment, please?
Through you, Madam Chair, it's a very important timeline that we're on for this one, to have it approved today, that will bring us back to Board of Health, allow us to come back to Board of Health in September, and allow us to meet our commitments that we've made for budget in this year and next. And so if we're able to move it today, I don't like not being able to discuss it more fulsomely with council and the Board of Health, but if we are able to move this today, that would be great.
All right, so Councillor Jackson, please, did you want to comment on that?
Madam Deputy Mayor, I have read the report, but I would never stop any discussion of any of my colleagues that really want an in-camera discussion on personnel. But I've read it. It's basically switching positions within 2 divisions at no impact on the levy. I'm satisfied moving forward without going in camera, but however, I don't want to stop, prevent any of my colleagues that need to have more information. But if none do, please come back to me.
All right, thank you, Councillor Jackson. Councillor Clark, please.
I agree with Councillor Jackson. Perhaps if any of the councillors, even some that may not be here, have concerns, they can raise it at the council meeting when it comes forward for ratification. And if we need to go in camera, then we could do it at that point.
All right, I am seeing around the table, though, a nod of heads that everyone seems to be in agreement that we can move this without going into private session. So seconded, moved by Councillor Pearson, seconded by Councillor Whitehead, all in section of 12. All in favor of 12.1, please. Sorry, 12.2.
Carried.
Carried. Thank you. Anyone opposed? All in favor? Carried. Thank you. Motion to adjourn. That would be Councillor Jackson and Councillor Collins. All in favor, please. Excellent work, everyone. Thank you. Flying by the seat of my pants once again with no notes.